something for a woman to be pregnant and carry pregnancy to term and deliver them and take them back home alive. Hello, my name is Dr. Mercy and I'm a medical officer here in Bright Star Specialist Hospital.
Hi, my name is Iwokereke Makleta. I'm the Director of Nursing in Bright Star Specialist Hospital here in Alpha. The woman came in the afternoon, or in the morning rather. She came in the morning that she was in labor. We monitored the labor all through. But at the time, we saw that she wasn't progressing all that. And the scan she did elsewhere was showing single baby. But at the time, we saw that the pregnancy, the labor wasn't going well. What we now did was to take her to the theater and we sectioned her. Lo and behold, bouncing baby boys came out, swinging gestation.
Well, it was kind of an experience for us, not because we're not used to it, but because of the presenting, circumstances behind the whole situation. For a woman who had not had any prior antenatal visits, no ultrasound scan done, she didn't even know her last menstrual period. So it was actually a very tough one for us. But however, we were able to handle her case. Now, it's really a thing of a concern because most mothers are also in this same category, like our patients we just had, where they tend to go to the traditional birth attendants and they don't do the normal routine screening and the ultrasound scan that are meant for the pregnancy. They don't take their medications. They don't even see the doctor up until they want to give birth, and they come up with so many complications that may even lead to the death of the babies or the mother. In this case, this woman had a twin gestation that she had no idea about. She had never been to the hospital. She had never had the normal routine medications or ultrasound scan done. And it's so even very concerning because most times children can actually present in a very poor or wrong position that could lead to CS or emergency cesarean section, like we call it. And this case was actually a very delicate one because we were just like, we didn't really know any idea about the woman. But because she came to Bright Star, luckily for her, we have capable hands, capable nurses, midwives, and also gynecology specialists, and also our radiographer who was also on ground to help us do an urgent, obstetric scan for us, and we're able to manage and handle her effectively. And to the glory of God, babies were delivered. One of the child had, one or two challenges. We also had efficient healthcare practitioners to ensure that the baby actually recovered because it had to be put on oxygen. Now, all of this would have been avoided if she didn't go to the TBA and she had labored for a very long time before coming down here. So, but we were able to handle the whole situation, and to the glory of God, mother and baby are fine.
I don't know, I just came here with one dress.
Okay.
And surprised that it's twins.
Wow.
I think she was scared and anxious, but we as the medical practitioners, we had to give her hope. We had to encourage her and ensure and let her know that she was actually in capable hands and able to, perform the surgery without any complications and ensure that the children are also fine. And I could just remember the joy in her face when she could hear her baby crying, and when we showed her the babies, she was filled with joy. And not just that, when we called in the father to come and see the children, you could imagine the surprise in his face when he even knew they were actually doing and they were doing so well. It was something that was inspiring to me as a medical practitioner, because it's not just about having a patient, but it's to ensure that your patient is satisfied and is happy with your services. And that was a very big one for me and all of my team as well.
Praise the Lord.
My wife has never given birth to a well-furnished like this bride style. She has been going to these maternal so this is my first experience, and I can say a lot. Like my wife said, both the instrument and so many other, there are a lot of differences.
Okay.
A lot to be compared. As the name implies, they prove it. The caring is what I can rate them more than 100%.
Wow.
Because all the nurse, the doctors and everyone, they patronize and they give you, like as my wife said, is indeed a caring.
Oh.
I think the major thing we're actually thinking of in the theater was just ensuring that the baby is come out alive and the mother is fine. Actually very important because when someone has hope and faith in you, it also helps to intends to help the procedure or the process or the care go swiftly because they trust you. And it's something that we as medical practitioners, we take into cognizance because this person has hope and faith in us to actually deliver. We just have to do our best. And we do that not just medically, we also try to talk to them as the process is going on. You're going to be fine, you're going to be okay, your babies are going to be fine. And when everything is fine at the end of the day, we are all happy and we want to follow that.
Thank you to feel happy and comfortable, to lose hope that you will not be afraid that maybe you will go, you will die, or something will happen to you.
Okay.
They'll make you to feel strong, happy, give you some word that will make you to be strong.
That's amazing.
Right now in the hospital that I've come to know, we want to invest a whole lot of money into the care of a patient. Why do I say this? They want to, invest money into getting the modern facilities and the machines at no cost. We have so many machines here that will ensure that the patient's needs are being at any time, so that we don't have the delays. We have 3 kinds of delays when dealing with a patient. Like for example, you go to a hospital, they tell you this one is not working, this one is not working. That's more here in Brightstar because we have almost all the machines we need to ensure that this patient's health is actually doing so well. And not just that, the staff. We have this love and this bond, this unity amongst them. They want to ensure nothing goes wrong in patient care. They always want to be involved in patient care. And this is something that is actually very, very, admirable to usually see in facilities. And I think those are the 2 things that actually drew me to Brightstar.
We always assign 2 nurses to all pregnant mothers. So once they come in, from the gate, we'll be alerted. And once the nurses are alerted, we'll just move in, help the woman, take her to the labor ward, reassure her. Of course, a pregnant woman that is in labor needs reassurance. So we always reassure them and also provide everything they need to be comfortable. We also, most of the times, we provide the vaginal therapy for them so that they won't feel the pain or that. We do everything to make sure that our patients are very, very comfortable.
Brightstar is a modernized hospital, not just for the young, but also the elderly people. It's something that is not usually common around us. And I love Brightstar. Brightstar loves this patient.
Feel happy. I feel happy and confident that I will tell glory to God.